Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Radical nephrectomy. Okay. Radical nephrectomy is actually the primary treatment which is given for localized renal cell carcinoma. Okay. In radical nephrectomy, what do we do? The main goal of the radical nephrectomy is to remove the tumor. We should first and foremost remove the tumor, and we should also take a normal margin of the wide margin of the normal tissue. That means if this is the tumor, if this is the kidney, and in the kidney, if this is the tumor, okay, if this is the tumor, okay, now this is the tumor, we have to remove the kidney definitely, and along with the kidney, if the tumor has invaded into the Gerota's fascia or surrounding renal fat, not gerotosphacia, if it has involved the renal fat, then we should make sure that the margin here should be histologically normal. If the margin here contains the tumor cells, then that means you did not take the adequate resection. You should resect it even more and make sure that the margin is normal. If you leave even one single tumor cell, that can cause recurrence of the tumor. So we do not want not even one single tumor cell left in the body. So in radical nephrectomy, what do we actually do? In radical nephrectomy, first we should ligate the renal artery and the vein. So this ligation also, first you will ligate the renal artery followed by renal vein. Okay, there are two things. Yes, in the ligation, first renal artery is ligated followed by renal vein, but vein is encircled and then artery is ligated. That means there is renal, if this is the kidney, we have a renal artery and we also have a renal vein. Okay, so this is the right kidney, so right side inferior vena cava will be there. Okay, circle the vein and then you will ligate the artery. But first you will have to ligate the artery, but encircling is done first by the vein. Then we should remove the kidney. The kidney is removed by a primary dissection external to the Gerota's fascia. So the removal is done external to the Gerota's fascia, that is outside the Gerota's fascia. This is the Gerota's fascia covering the kidney, and you will have to do the resection outside the Gerota's fascia and you will remove the whole kidney. And then above the kidney superiorly we have adrenal gland, so even we will remove the adrenal gland also is removed. Then there is complete regional lymphadenectomy should be done. That is from the crus of the diaphragm to the aortic bifurcation, we do the complete regional lymphadenectomy. That means in the descending aorta, this is the diaphragm. This is the descending abdominal aorta which will bifurcate into the common iliac vessels. And before bifurcation, here it will give renal artery to the kidneys. So you will, and along this along this aorta we have different ranges of lymph nodes, from the celiac lymph nodes to the superior mesenteric nodes, inferior mesenteric nodes, pre-aortic, para-aortic nodes, then renal nodes, all those are present. So we should do complete regional lymphadenectomy from the crux of the diaphragm to the aortic bifurcation. All the lymph nodes are removed in radical nephrectomy.
thank you and thank you for watching.